Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Artimether plus Lumafantrine, its classification, indication, dose, strength, administration, pregnancy status, adverse effect, drug-drug interaction, precautions, and instructions. Drug generic name Artimether plus Lumafantrine antimalarial drug. Its classification antimalarial agent. Indications acute uncomplicated malaria caused by Plasmodium falciparum strain or parasite. Dose in adult tablet formulation. Dose is vary according to the strength. In tablet 20 by 120 mg. Adult take 4 tablet as single dose, followed by 4 tablets after 8 hours of first dose. Then take 4 tablets once daily for further 2 days. Total course of 16 tablets. Tablet 40 by 240 mg. Take 2 tablets as a single first dose, followed by 2 tablets after 8 hours of first dose. Then 2 tablets once daily for further 2 days. Total course of 8 tablets. In strength of tablet 80 by 480 mg adult dose, take 1 tablet as a single first dose, followed by 1 tablet after 8 hours of first dose. Then take 1 tablet once daily for further 2 days. Total course of 4 tablets. In pediatric dosing, dosage form and strength available tablet 20 mg by 120 mg. Greater than 2 years are recommended. Weight 5 to less than 15 kg. Administer 6 tablets over 3 days. In frequencies are take 1 tablet initially and again after 8 hours of first day, followed by 1 tablet BID morning and evening for next 2 days. Weight 15 to less than 25 kg. Administer 12 tablets over 3 days. Take 2 tablets initially and again after 8 hours of first day, followed by 2 tablets BID morning and evening for next 2 days. Weight 25 to 35 less than 35 kg. Administer 18 tablets over 3 days. 3 tablets initially and again after 8 hours of first day, followed by 3 tablets BID morning and evening for next 2 days. For pediatric administration, take with food. Tablet may crush and mix with small amount of water. Follow dose with food or either drink. If patient vomit out dose within 1 to 2 hours, give another dose. Pregnancy. Use of this medicine in pregnant women is not recommended unless absolutely necessary. Your doctor will evaluate all the patient risks and benefits associated with the use of medicine before prescribing it. Adverse effects are abdominal pain, anorexia, diarrhea, vomiting, nausea, palpitation, prolonged QT interval, cough, headache, dizziness, asthenia, sleep disturbance, paresthesia, arthralgia, myalgia, pruritus, and rashes. Drug-drug interaction, erythromycin, severe drug interaction, QT pain, severe drug interaction, ciprofloxacin, severe drug interaction, doxorubicin, severe drug interaction, doxypan, severe drug interaction, azithromycin, severe drug interaction, citalopram, severe drug interaction. Precautions during driving. Please avoid driving while taking this medicine as it may affect your ability to drive. General instructions are: take this medicine with food as directed by your doctor. Do not take in larger or smaller amount than advised either prescribed. Consult the doctor if you experience any undesirable side effects. Ensure that treatment course is completed. Do not stop the use of medicine without consulting your doctors. Thank you for watching Daily Drug Info.